Today we will discuss some of the questions which might come for your examinations. So let's begin. So the first question is, a mother brings her newborn to a clinic concerned about child's unilateral cleft lip. What is the most likely explanation for formation of this? So many times cleft lip is asked as a question for your exam. So it's very important that cleft lip and palate both are important. Okay. So here the options are failure of fusion of frontonasal process and maxillary process, lateral nasal process and maxillary process, medial and maxillary process, or lateral and medial nasal process. So let's go to the discussion part. So this is the development of face. So here, this is the frontonasal process. This one is the frontonasal process. And here it is the medial nasal. Then this is the lateral nasal process. Okay. So this is the maxillary process and this is the mandibular process. And this is the future eye. Okay. And here it is the fusion of lateral nasal, lateral process and the maxillary process. This is the fusion, okay, of lateral process with maxillary process. And here this is the nasal pitch, and this is the fusion of maxillary process with medial nasal process. This is the fusion of mandibular process, and here it is the intermaxillary process fused with medial nasal process, and this is the philtrum of the nose. So these are the various process in the development of the face. So this is the cleft lip. Okay, this is the unilateral cleft lip and this is the bilateral cleft lip. So cleft lip, it mainly occurs in the upper lip. Okay, and the incidence is 1 in 1000 births. Okay, and 60 to 80% of the children is involved, and which are males. So males are mostly affected. And the cleft upper lip is present in various three varieties. That is, the first one is unilateral cleft lip, second one is bilateral cleft lip, and third one is there, that is central cleft lip or hair lip. Okay, so unilateral cleft lip is due to the failure of fusion of maxillary process with medial nasal process. So this is the reason for unilateral cleft lip. What is the reason? Fusion of maxillary process with the medial nasal process of the same side. That is the unilateral cleft lip. And in bilateral cleft lip, it is due to the failure of fusion of maxillary process with the frontonasal process. So maxillary process and frontonasal process, it is bilateral cleft lip. And what is for central lip, central cleft lip or hair lip? It occurs due to failure of development of the philtrum of upper lip from frontonasal process. Okay, that is for a central cleft. So this is the unilateral cleft lip and this is the bilateral cleft lip. So what is the answer? Unilateral cleft lip is occurs due to the failure of fusion of medial nasal process and the maxillary process. Okay. So coming to the next question, palatoglossus is supplied by which muscle is that? Yeah, muscle of tongue. So options are 9, 10, 11 and 12. So which is correct? This is the picture showing muscles of tongue. There are extrinsic muscles and the intrinsic muscles. So extrinsic muscles are palatoglossus. This is the palatoglossus, and here it is the xyloglossus, then hyoglossus and genioglossus. These are the extrinsic muscles. And intrinsic muscles are superior longitudinal, vertical, transverse and inferior longitudinal. So intrinsic muscles are two longitudinal muscles, one vertical muscle and one transverse muscle. Extrinsic muscles are palatoglossus, xyloglossus, hyoglossus and genioglossus. Okay, so the muscles which are styloglossus, hyoglossus and genioglossus, these are supplied by the hypoglossal nerve. Which one is the hypoglossal nerve? Yeah, 12th cranial nerve is the hypoglossal. But palatoglossus is supplied by the vagus nerve. Which one is that? 10th cranial nerve. So all the muscles of tongue except palatoglossus, which is supplied by the hypoglossal nerve, where palatoglossus is supplied by vagus. Okay, so it is the 10th cranial nerve. So what is the mnemonic for remembering the cranial nerves? Yeah, it is Uta Fagva. It is very much detailed in and explained in previous video. You can watch that video if you have not watched that video. Okay, then that is the mnemonic for remembering the cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal, vagus, accessory spinal, and hypoglossal. So hypoglossal is the 12th cranial nerve and vagus is the 10th cranial nerve. Okay, so palatoglossus is supplied by vagus nerve. So what is the answer? Yeah, it is 10th cranial nerve. So you should know the number also. Okay, that is 10th cranial nerve is that? Yeah, vagus nerve. Vagus nerve is the 10th cranial nerve. Okay, and this question is otherwise asked as another question, that is another way, that is hypoglossal nerve supplies all of the following muscles except. Okay, this you already know. Which are they? Hypoglossal nerve innervates styloglossus, hyoglossus, and genioglossus. Whereas palatoglossus is supplied by vagus nerve. So answer is palatoglossus. So next question is levator palpebrae superioris is supplied by which nerve? So options are 3, 4, 7 and 8 cranials. So which one is that? Levator palpebrae superioris is a muscle of facial expression, but this is supplied by the oculomotor. Okay, so levator palpebrae superioris is supplied by oculomotor nerve. All other muscles of facial expression is supplied by facial nerve. That is the most important point. Okay, to note it. Then, which are the other muscles supplied by the oculomotor nerve? So, moving to that, muscles of eyeball, which are they? Yeah, LR6, SO4, AO3. What is this AO3? That is lateral rectus, 6th cranial nerve, superior oblique, 4th cranial nerve, and all others are 3rd cranial nerve. 3rd cranial nerve is that oculomotor. So, abducens, trochlear, oculomotor. So, levator palpebrae superioris by oculomotor. So, and it elevates the upper eyelids. So, the damage to these muscles, that is levator palpebrae superioris, and their innervation, which can cause ptosis, which is the drooping of the eyelid. And the lesions in this cranial nerve, that is 3rd cranial nerve, that is oculomotor, which can cause ptosis because without stimulation from the oculomotor nerve, the levator palpebrae cannot oppose the forces of gravity and the eyelid droops. So it is very important, that is damage to these muscles and their innervation causes ptosis. Okay. So the answer is levator palpebrae superioris is supplied by 3rd cranial nerve, that is oculomotor. So coming to the next question, structure marked in this image is pierced by which nerve? So this is the marked structure. Okay, which is this structure and which nerve which is pierced through this structure? Okay, that is options are superior laryngeal nerve, internal laryngeal nerve, external laryngeal nerve, and recurrent laryngeal nerve. So which is correct? So this is the picture. Okay, here which nerve innervates this area? Which nerve? Yeah, it is vagus nerve. Okay, which is the vagus nerve? Vagus nerve is 10th cranial nerve. And what are the parts of vagus nerve? So it gives rise to superior laryngeal nerve and the recurrent laryngeal nerve. Okay, what is the superior laryngeal nerve? Superior laryngeal nerve divides into internal laryngeal nerve and external laryngeal nerve. So these are the branches of superior laryngeal nerve. Which are they? This is the superior laryngeal nerve. Here gives rise to two branches. This is the internal branch of right superior laryngeal nerve, and this is the external laryngeal nerve. So this is the internal laryngeal nerve and this is the external laryngeal nerve. Okay, and this one is the recurrent laryngeal nerve. So what is this structure? This is the thyrohyoid membrane. So the structure which is pierces the nerve which is pierced through the thyrohyoid membrane is the internal branch of superior laryngeal nerve. Okay. So this is the hyoid bone, this is the thyroid cartilage, and this is the thyrohyoid membrane. And the nerve which pierces the thyroid membrane is the internal laryngeal nerve. And this is the external laryngeal. Okay, this is the recurrent laryngeal. Clear? Yeah. So this is the hyoid bone, this is thyroid membrane, this is the thyroid cartilage. These are the level of the vocal cords. Here it is the cricothyroid muscle and this is the cricoid cartilage. Okay? Yeah. So what's the answer? It is internal laryngeal nerve. Clear? So the next question is level of thyroid cartilage. Between C1 and C2, C2 and C3, C4 and C5 or C5 and C6. Coming to discussion part. So this is the thyroid cartilage and this is the thyroid membrane. This is the hyoid bone. Okay, so this is the thyroid cartilage and here it found between the levels of C4 to C5. So C4 to C5 vertebra is the answer. Okay, and there is an oblique line which is the line on the thyroid cartilage. It marks the upper borders of the thyroid gland and two muscles originate along the line is the thyroid muscle and the inferior pharyngeal constrictor. And the sternothyroid which inserts along the line. And movement of the cartilage at this joint produces a change in tension at the vocal fold, which in turn produces the variation in voice. Okay, so this is the larynx, this is the thyroid cartilage, the cricotracheal ligament, this is the trachea, this is the cricoid cartilage. Okay, so what is the answer? It's between C4 and C5. So coming to the next question, maxillary nerve passes through which foramen? Foramen ovale, foramen rotunda, foramen spinosum and foramen lacerum. So let's go to the discussion. So these are the various important foramens. This is the foramen ovale, this is the foramen magnum, this is the foramen rotunda, this is the foramen spinosum and this is the foramen lacerum. So foramen ovale, it is a mnemonic that is male, M-A-L-E. What is M? M for the mandibular nerve, A for accessory meningeal artery, lesser petrosal nerve, then emissary vein connecting cavernous sinus with the pterygoid plexus of veins. That is ovale. Okay, mnemonic is male. M for mandibular nerve, A for accessory meningeal artery, lesser petrosal nerve, and emissary vein connecting cavernous sinus with the pterygoid plexus of veins. So foramen rotundum, it is the maxillary nerve. Foramen rotundum is the maxillary nerve. So foramen ovale is mandibular nerve mainly. Then foramen spinosum, middle meningeal artery, meningeal branch of mandibular nerve and posterior trunk of middle meningeal vein. And foramen lacerum is meningeal branch of pharyngeal artery. So the correct answer is foramen rotundum. So Coming to the next question. Facial muscles are derived from which pharyngeal arch? First one is first branchial arch, second branchial arch, third and fourth. Which one is correct? So coming to some embryology, this is the pharyngeal arch. Okay, and here this is the second arch, this is the first arch, second arch, third arch, fourth arch, fifth one is disappears, and sixth one is there. Okay, so this is the pharyngeal cleft. Here this is the pharyngeal cleft, and these are the pharyngeal pouches. So this is a table related to pharyngeal arches. So first one is the first arch, which is innervated by the mandibular nerve, and the artery is the first aortic arch artery. First aortic arch artery. Okay. Then second one is the facial nerve. Here the artery is stapedial artery. Stapedial artery. So first arch, it is applied by the mandibular nerve and supplies various muscles of mastication, tensor tympani, tensor veli palatini, then anterior belly of digastric and mylohyoid. And the skeletal components are maxilla, mandible, malleus incus, sphenomandibular ligament, anterior ligament of malleus. Okay, so here noted that malleus and incus are innervated by first arch. Okay, that is mandibular nerve. Then next one is the facial nerve, that is the nerve of second arch. It is supplied by the artery, that is stapedial artery, and this supplies various muscles of facial expression, occipiter frontalis, platysma, posterior belly of digastric, stapedius, stylohyoid, auricular muscles. And the skeletal components are lesser corner and superior part of hyoid bone, styloid process, and stapes and stylohyoid ligaments. So this is by facial. Okay. And the first arch by mandibular. Then third arch, the nerve is glossopharyngeal nerve, that is ninth cranial nerve. Here right and left common carotid arteries, and it supplies the muscle stylopharyngeus. And the skeletal components are greater corner and inferior part of hyoid bone. Then fourth arch, it is superior laryngeal and pharyngeal branches from vagus to pharyngeal plexus, right subclavian artery and arch of aorta. All the muscles of pharynx except stylopharyngeus, because stylopharyngeus is supplied by glossopharyngeal nerve. And all the muscles of pharynx other than the stylopharyngeus is supplied by superior laryngeal nerve. All the muscles of palate except tensor veli palatini. And because tensor veli palatini is supplied by mandibular nerve. And then cricothyroid muscle. And the skeletal component is laryngeal cartilages. Okay. And fifth arch, it disappears soon. And then sixth arch, recurrent laryngeal nerve of vagus. Then right and left pulmonary arteries and ductus arteriosus. All the intrinsic muscles of larynx except cricothyroid, because cricothyroid muscle is supplied by pharyngeal branches from vagus to pharyngeal plexus. Then inferior constrictor. Then the laryngeal cartilages. Okay, so fourth arch, that is cricothyroid muscle, and sixth arch, that is laryngeal cartilages. That's all the intrinsic muscles of larynx except cricothyroid and inferior constrictor. Okay. So the answer is second branchial arch. So coming to the next question, which condition is seen in Fanconi syndrome? Dolichocephaly, brachycephaly, microcephaly, or scaphocephaly? Okay, let's see some conditions. That is acrocephaly or oxycephaly, scaphocephaly, plagiocephaly, anencephaly, microcephaly, brachycephaly, and dolichocephaly. So let's see one by one. So let's see one by one. Acrocephaly or oxycephaly. Here, premature, both the coronal and sagittal sutures resulting in a pointed skull. Okay, so here it is a pointed skull. Then what is scaphocephaly? Here the premature union of sagittal suture resulted in a boat-shaped skull. And then microcephaly, it is a small skull due to failure of brain to grow. And it is seen in Beckwith hypoglycemic syndrome and Fanconi syndrome. So this is the microcephaly, and here it is abnormally small head. Okay. The next is the plagiocephaly, a symmetrical union of sutures resulted in a twisted skull. Okay. Microcephaly, here it is small skull and seen with Beckwith hypoglycemic syndrome and Fanconi syndrome. Then anencephaly, characterized by missing of greater part of the vault of the skull. Then brachycephaly is the premature fusion of coronal sutures, forces the skull to grow wide related to its length, resulting in short and broad skull. That is brachycephaly. And with flat occiput is seen in Down syndrome. Narrow foramen magnum is seen in achondroplasia. And absence of clavicles is seen in cleidocranial dysplasia. And then dolichocephaly, here it is long and thin skull, which is seen in Marfan syndrome. So these are the various conditions. So acrocephaly, scaphocephaly, microcephaly, plagiocephaly, anencephaly, brachycephaly, and dolichocephaly. Each one is very, very important. Okay. So what is the answer? In Fanconi syndrome, microcephaly is. So that's all for today's lecture. Please do like, share and subscribe my channel for more videos and enable the bell icon too. So, see you on next video. Bye for now. Stay tuned. Thanks for watching.